We'll take a look at the beach at the Carolina coast today. Spending time in the sun during the summer often means taking care of your skin and avoiding a sunburn. Too much sun can also increase chances for wrinkles, and some people are also concerned about conditions like acne and rosacea. So today we are talking all about skincare, from do's and don'ts for healthy skin to skincare options that you may not have thought about before. Here today is Dr. Claire Dillingham with Cone Health Plastic Surgery Specialist. Good afternoon to you, and thank you for joining us today.
Thank you for having me, Cindy. It's great to join you and your watchers.
Absolutely. Well, let's start here. We all know we should be wearing sunscreen to take care of our skin, but what else should we be doing? What are some tips for, some do's for that healthy skin?
Well, Cindy, it's never too early to start looking at your skin and taking care of it. We all know that when we see pretty skin, it means it's healthy skin. So healthy skin is pretty skin. So taking care of it early on, and there's no, you're never too young to start taking care of it. It's really important so that you can have healthier skin longer. So definitely want to do that. And this time of year, be really good about sunblock.
Okay, absolutely. And what are some don'ts that we all need to be aware of?
Well, I think some of the things that we end up doing sometimes just out of a packed, busy day is neglecting our skin. Maybe we go to bed without washing our face, or in the morning we get up and we run. But it's really important at night to wash your skin, wash your face with a nice, healthy skin cleanser. And then in the morning, putting your sunblock on is really important to get you through the day without the sun damage, because that's what makes you look older, causes discolorations, the redness, and the wrinkles.
And of course, we know sunscreen as well too, but can you talk about some different products, outside of sunscreen that also kind of helps with protecting your skin?
Oh, sure. We've got three of my favorite products are the Elta MD line, which is really good with sunblocks and cleansers. It's gentle on the skin and helps with the pH balance. And then another one that has a real nice kit to it is the Zeo products, which are real nice because you can get a whole kit that has everything you need, from the cleanser to the scrub, to the pads to really clean deep in the pores. They're similar to the OxyPads, if you remember those from years ago. And then the other one is the Sente, which has the heparan sulfate in it, which is really good for sun damage. So a lot of products out there that you can get at your physician's office, and you're going to get your money's worth. That's the thing about getting your money's worth, so you know what you're putting on your skin is safe and effective.
And that was actually my next question, kind of where are the best places to, get some of these products? You talked about the doctor's office. Any other good locations?
I think your doctor's office, where they've got an esthetician or somebody who specializes in skincare, like your dermatology office. Certainly at our office at Cone Health Plastic Surgery Specialist, we have got both board certified plastic surgeons and an esthetician. So we can really evaluate your skin, see what it is that you need, what your desired goals are, and work with you to come up with a plan that fits both your skin and your regular routine, your daily routine.
That's good. I want to talk about the order. What order should you put on your skin with using the products? And even along with sunscreen as well too, and mixing the products?
That's a great question. So it can be a little tricky, but generally speaking, if you're using a moisturizer or a sunblock, that's going to go under your makeup. So that's going to go on first. Now, there are some really good skin products that have the sunscreen and moisturizer. That makes it a lot easier to get on your skin. Plus, you don't get a buildup of product that makes you feel greasy. But you want to get that sunblock on first, so that it's starting to work, and then you can put your makeup on over that for women. And for men, just getting that sunblock on, and if you can get one with a moisturizer, that's going to be real helpful for you. And the Elta MD is a real good one for the moisturizer and the sunblock. And some of the sunblocks that we have are tinted, so that really takes the place of needing a foundation.
Yes, absolutely. And then you were kind of talking about some of the makeup products as well too that, are there some that are infused with acne fighting ingredients and sunscreen use?
Yes, and you want to be careful because if you get too much product in one specific product, you may not be getting enough of the product. You also want to make sure that it's not going to interact with your body in a way that may actually promote breakouts or redness. But it's okay if your makeup has sunblock in it, but it's usually not enough because the minimum is 30, especially in the summertime. And then you can move on to the higher products as far as for your skin health.
This is all good stuff. I'm excited about the rest of this conversation. We'll take a pause right here and continue the conversation after the break. We have Dr. Claire Dillingham with Cone Health, plastic surgery specialist, who is here with us today. There are some options for healthy skin that people may not think are options for them. What are some of those and what conditions are they, of course, used for?
Oh, Cindy, I think you may be referring to the laser treatments, the Botox, even fillers or um, nano peels. All of those can be really helpful for really taking away the dead layers of your skin, brightening it up. The lasers are wonderful for hyperpigmentation that comes with sun damage and sometimes with aging, the redness like rosacea. We have seen amazing benefits with patients with rosacea that get the thickened skin, that red burning, and the laser is amazing at really settling that down. And it can also help with some of the wrinkling as well.
Okay, and so now are these options in place of following a healthy skincare routine as well too? Okay.
Yes, so that's a really good point. So you're going to get a better treatment if you do the things that are needed for your actual skincare before that. We find that if you're taking care of your skin, if you do a regimen like the ZO regimen and get ready for the laser, you're going to get a better result. And the laser is not covered by insurance, so it is out of pocket. So it's a little more expensive than usually the skincare products. So you want to make sure that if you're going to make the investment, you're doing it in a way that you're going to get your full worth of it. So that can be really helpful.
All right, interesting. And then what are some common misconceptions about laser treatments in even injectables that you want to set the record straight on?
I think the biggest one is that a lot of people think that they're only for women, but men need to take care of their skin too. It's really important for health and prevention of skin cancers to be taking care of your skin. So it's for men and women, it's for the younger age group in their 20s and 30s, or the mature age group in your 60s or 70s, and everywhere in between. Also, it's for all skin types and colors. It can be used for all of that. And so it's really nice. We've got an amazing laser that offers every skin type something that's of benefit for really getting that goal of healthy looking skin.
And if someone is interested in learning more about skincare services and if it might be right for them, what is the process? I would assume that it might be different for certain people.
Well, you give us a call or go to our website and request information. But the best is to come in, sit down with us, let us look at your skin, tell us your goals, and we can work out a plan that fits both your lifestyle and your budget so that we can really work on that journey together.
And a consultation would kind of come first as well too, because I know a consultation is a great opportunity for folks to ask as many questions as they need to. Kind of talk about that consultation process.
Yeah, so you would come in and it's usually around 30 minutes and we would talk about your goals. If you wanted something that would help with the upper face, we think of as the area for the Botox, to really relax it and give you that refreshed look. Then the mid face for your filler, and then the whole face neck and chest area is your skincare products, your lasers, and your peels. So we would go through all of that. And then, of course, talk about if there's any role for surgery. But our goal would be to get you where you need to be the fastest and the healthiest. And a lot of times that is with the products and the laser.
Absolutely. Well, Dr. Dillingham, thank you so much for joining us today. If you missed any of today's segment, all you have to do is head over to our website and click in the To Your Wellbeing section.